Here we'll talk about complicated cataract. So for this you need to remember a mnemonic, nutrition. So what comes under nutrition? There will be a balanced diet, right? So how will the balanced diet look? It looks colorful. With the different vegetables and fruits, it looks colorful. So remember this word, nutrition and colorful. And also in the nutrition you can also have bread and high calcium foods, right? So nutrition, bread, high calcium and colorful. You need to remember this. So when you take good food, you become strong and rigid, right? Also remember this word, rigid. So once we done with the mnemonic, now let us see what is complicated cataract. It is opacification of lens secondary to other intraocular diseases. That means there is a disease present in the intraocular structures, which leads to the complication in the lens, which is complicated cataract. So the lens depend on intraocular fluids for its nutrition. So in any inflammatory conditions or disturbed ocular circulation, which leads to the disturbed intraocular fluids, which leads to the disturbed nutrition of the lens, leading to the complicated cataract, right? So lens depend on intraocular fluids for nutrition, right? If there is any problem occurring in the intraocular fluids, it will lead to the deprivation of nutrition in the lens, leading to the complicated cataract. Etiology. For remembering the etiology, you need to remember the word rigid. R stands for retinal detachment. Long-standing cases of retinal detachment leads to complicated cataract. Inflammatory conditions like anterior uveitis, corneal ulcers, iridocyclitis. Itis means inflammation in pathology, right? Choroiditis, etc. So the G stands for glaucoma. Why? Because of the raised intraocular pressure, there will be also glaucoma, which can lead to complicated cataract in the later stages. The I means intraocular tumors like retinoblastoma or melanoma, which can also lead to complicated cataract. And degenerative conditions, D, that is retinitis pigmentosa. These are the degenerative conditions which can lead to complicated cataract. For the etiology, remember the word rigid and write these things. So clinical features. What will be seen in the clinical features? It starts as a posterior subcapsular cortical cataract. In beam of slit lamp opacities, which we can do for the examination, you can see breadcrumb appearance. First we spoke about bread under the mnemonic, right? I asked you to remember few words like nutrition, bread, high calcium, colorful, rigid. So here the word breadcrumbs is used. So breadcrumb appearance, calcium deposition in the later stages, polychromatic luster, which means appearance of different colors like red, blue, green, etc., which is also called as rainbow cataract. And opacity spreads to the whole cortex, leading to the dirty white appearance. So I asked you to remember bread, high calcium, variety of colors, right? The variety of colors here are red, blue, green, which are polychromatic luster, also known as rainbow cataract, and yellow haze seen in the adjacent cortex, and dirty white appearance can be seen in the whole cortex in the later stages when the opacity spreads. So this is about complicated cataract.